And this hangout is now live. So this is our first trial experiment episode of Dudes Be Debating, and we are your dudes. My name's Andrew Garber. This is Scott Watson, and we are going to be debating. Scott and I have been good friends for a long time, and we find each other on the opposite sides of a lot of issues. And because we are both intelligent, thoughtful people, we thought it would be fun to tear into each other's ideas. That's what we thought would be fun to do.
At least kill a little time.
Yeah, and hide in our bedrooms away from our families, mostly. Yeah, sure. So tonight we're going to talk about healthcare, and I am going to let Scott talk about himself a little bit and why we're going to talk about healthcare tonight.
All right. Well, as Andrew introduced me, my name is Scott Watson. I've had a very, very interesting life. I think a lot of the differences between Andrew's opinions and my opinions come from the different life experiences that we've had. So I think it's important to bring those life experiences to the forefront. I spent the formative years of my younger adult life as a complete bum. I sponged off of other people. I didn't really have any goals. I didn't really have any desires. I met my wife actually playing hacky sack on the corner of Wabash Avenue with her brother in front of the coffee grounds, popular college hangout. Long story short, I moved to Indianapolis with her. She had a daughter, and I realized that I needed to become more of a provider. I got into the law enforcement field in Indianapolis, law enforcement security. I did that for about 5 years and decided that was just about enough time to understand that I didn't want to raise the other two children that my wife and I had in Indianapolis. So I moved out to, yes.
Hey, Scott, not to interrupt you, but are you clicking a pen?
Yes, I will stop.
Yeah, you should.
I don't get along with talking about myself. I thought we were going to be talking about healthcare, so it's a nervous habit. I also am sitting currently at my present job position where I've been sitting all day working, and when I'm talking to people, trying to become not irritated with them. So we will put that back there for the time being. In continuation. So I moved out to the country with my family, and discovering in Indianapolis that I was a bit of a, for lack of a better term, a bit of an action junkie. I joined the state working in corrections, and I joined the emergency response squad, and also joined the volunteer fire department. Did that for 4.5 years. I became a medical first responder, and later went to EMT school, well, not EMT training, and I graduated, but I did not go to my clinicals because I ended up leaving and going to the Middle East to be a force protection officer, which I did for about 6 to 8 months before the contract ended and I came back to the United States. Currently, I own 2 businesses. I own a trucking business, and I have a dispatch business that is also attached to that, where I contract with other small trucking companies to help them find their freight and keep their trucks moving. So that's the background that I come from.
Awesome.
My position on healthcare is very interesting. We'll get into that in a minute. I'm going to let Andrew talk. I got another pen somewhere. I'm going to let Andrew talk about his background a little bit.
Yeah, you should totally do that as the kid comes asking for homework help. Yeah, Corbin, I'm kind of in the middle of a thing. Can you? Maybe...
Hello, Corbin.
I need help.
My kids are on spring break.
Oh, all right.
We can pause.
Just leave it. I scheduled this for this time so that wouldn't happen.
Best laid plans, my friend. Best laid plans.
Okay, so he'll be fine. Let's it's a homework problem, and the kid gets straight A's, and if he doesn't understand it, then it's the one thing that he doesn't understand so far. Okay, so the reason that healthcare is an important thing for me is because I actually work in healthcare. I work in mental health. I work at a community mental health center and I do billing there. That's kind of what I do there. Since before 2010, when the Affordable Care Act was passed, and ever since then, really until 2015,
Hey, Andrew.
when yeah, yes,
You keep pausing and peeking out.
I do. Well, so I was just saying that that my current employment has to do with mental health billing, and that's kind of what I get to do on a daily basis. I get to play in the healthcare field, not being a healthcare provider at all by any stretch of the imagination, but I get to play in that field a lot. Um, since before 2010 and since 2010, being in Indiana, Indiana just sort of kind of expanded its Medicaid in 2015 with Healthy Indiana Plan 2.0, which has been awesome um, and amazing. And I just all of the criticisms that I have, and I have plenty of criticisms about the Affordable Care Act, but most of them tend to be on the side that the that the law did not do enough, it didn't make enough things happen. A lot of when it comes to the Affordable Care Act, there were there were three basic ideas that we had that we were trying to address, and we were really doing all these things to address the problem of the uninsured. Okay, there wasn't a whole lot of question about access, although that is absolutely a problem, and it is a real criticism of the Affordable Care Act that it didn't do enough to address access to care and only focused smallly, I think, on insurance. The problem that it was trying to address was the uninsured. That there were, I think, the statistic at the time was like 40 some odd million people that were uninsured. That were just and when the uninsured sought care, what would happen is they would generally wait until their care needs became urgent and then would use the emergency room or use the emergency room in non-urgent um, situations, all of which created a huge drain on the health care system that we have now. So the Affordable Care Act was supposed to do three things. No. The Affordable Care Act was supposed to do one thing, address the uninsured, and it was going to do that in three ways. We were going to make it so that insurance companies had to accept people for coverage. We were not going to allow them to exclude people for pre-existing conditions. We were not going to allow them to exclude them on the basis of their current health state. Okay. The idea was that people should not be penalized for getting sick. All right. We also needed to then make sure that there was an incentive for healthy people to get insurance, because if you cannot exclude people on the basis of health, then there is no incentive for healthy people to get insurance. And so we had the individual mandate. And the third part was that there were going to be people that were not going to be able to afford coverage, whether they be healthy or not healthy. And so we have the Medicaid expansion part. And these three things were supposed to work together in order to address the problem of the multitude of people who did not have access to health insurance. Before we went live, I think this is a good place to bring in a point that you brought up earlier. that before we went live, you said that health care does not necessarily mean health insurance. And while that is true on its face, I think that if you don't have insurance, you don't get care unless it is in an emergency setting. And what the Affordable Care Act was designed to do is keep people out of the emergency room, keep people from using the emergency room as a clinic. Okay. Um, you can use the emergency room in an emergency. Okay. If you have an actual emergency, by golly, get to the emergency room and be there. But if it's not an emergency, you need to be able to use a clinic for clinic-like needs, right? For the sniffles, for an infection, clinics, not the emergency room. And don't let your infection become an emergency because we've delayed care for so long that it now is a legitimate emergency. These three prongs then of not allowing companies to disallow coverage, of an incentive for healthy people to become insured, and for a Medicaid expansion to allow people who can't afford it to get coverage, along with the marketplaces, the commercial marketplaces, where people who were not able to get insurance from their employer, not able to purchase an employer provided plan, could go to a marketplace and purchase things. And if your income is less than 400% of the federal poverty limit, you get tax incentives, you get a tax subsidy on those premiums. So to make healthcare accessible, or not to make healthcare, but health insurance accessible so that insurance have to cover you, and to make it affordable were the three prongs of the Affordable Care Act. Since that time, I really think that I have seen the number of uninsured people that come through the doors drastically reduced. Drastically reduced. We don't have the uninsured population that we once had. That is to be absolutely sure. And for those people who don't have insurance, we can get them insurance today. And by that I mean, you come in the door, you don't have coverage, we can probably help get you coverage today. That's been tremendously impactful to every healthcare provider that I get to talk to.
Okay. I've sat here and I've listened to what you're saying about it, and I can't completely disagree, particularly with anything you said. I don't have the numbers or the statistics in front of me. I have heard 47 million people didn't have insurance. I've heard 3 million people didn't have insurance. If it was half of the country's population, you're thinking of it from a backwards angle. Because to start with, you have to determine that people need to want to be concerned about their health. And they are not. They are not concerned about their health. The reason that they sit at home and don't go to the hospital or don't go to the doctor is because they don't care until it gets to the point where it's an emergency. This I have experienced firsthand for many years. Secondly, there is no incentive to provide them with options for getting health coverage, okay? The status quo has always been you get health care from your employer, and that's the easiest way for insurance companies to make a profit, because they sell crap policies to big corporations, and big corporations accept them and faust them on their individuals. their employees. Now, what I propose is quite simple. Make a law that simply states you have to have health insurance from the time you're born. I am sure, reasonably sure, that most people attend a hospital location at least one time in their life. And at that one point in time in their life, if they are enrolled and introduced into the healthcare field through whatever policy their parents have already procured, that later on, when they're old enough, they can select their own. But you make a law that says you must be covered with healthcare insurance. You don't mandate a law that says you have to be covered with this portion of healthcare and cover this much money on this portion of healthcare. They should say you have to have healthcare coverage for the things that you'd like to do. And then the marketplace should and could adjust to somebody who is smart enough to have to do it, to get to the point where things like care credit became a part of the health care plan. I have never needed a breast augmentation. I have never needed I've never had a colon exam. Perhaps I should in about 5 years, if I'm not mistaken, but I've never had one yet. And I've never had an abortion, for example. And these are not things that I should have to pay for if I don't ever intend to have them. These are things that should not be on my policy or be paid for through my policy if I never intend to have them. However, there should be room to maneuver on that. But that's a private market thing, and that's a determination that each individual has to make. We also have to move away from a treatment-based care, especially in the medical field, and move more towards preventative. And the only way to do that is to make it worth their money to do so. Incentives for people to maintain a healthy lifestyle. Incentives, in other words, if I smoke 3 packs of cigarettes a day and I am 100 pounds overweight, then my insurance premium should be higher because I have chosen to live a very unhealthy lifestyle. And it's going to cost me more in the future. So we don't live in a society today where it's acceptable to look at things in terms of personal responsibility. We look at things in terms of I have the freedom to choose whatever I want to choose. Absolutely, a person has the freedom to choose whatever they want to choose. But there are consequences to all the choices that you make. And we don't encourage good choices. We encourage bad choices in our health, in our financial dealings, and throughout life.
If we're okay, so I don't see the apathy until the emergency thing in my day-to-day experience. What I see is not a lack of caring, but a lack of understanding what the options are. Okay, you talked a lot about giving people options, and that's cool. All right, but in order for those to be real options, in order for those to be options that one could act upon, then you have to know what those options are. Okay,
Exactly.
And we live in Indiana. Okay, where we have there are a lot of options actually in regard to health coverage through the Healthy Indiana Plan or through the federal marketplace, because Indiana doesn't run its own marketplace. But if you don't know what those options are and what those options mean, right? If you were going to enroll in the Healthy Indiana Plan, you would be faced with a choice of 3 different companies in order to manage your healthcare. You'd be faced with Anthem, MDWise, or a company called Managed Health Systems, which does business as Simpatico. All right. If you've only ever heard of one of those, as most people I run across have only ever heard of Anthem, okay? Even so, how do you know which one is actually going to be better fit for you? On what do you base that choice? All right. Now I know the answer to that question because I get to work in there, but I doubt that people outside of my, I doubt that people outside of me in my office understand which way to go. All right, because you're presented with a white egg, a speckled egg, and a brown egg. They all look like eggs to me. They'll all become over medium if I fry them. It doesn't. There doesn't appear to be a difference, and there are incredible differences depending on which one you go with. Sometimes there are real benefits to choosing one over another. Um, uh, I I understand what you mean when you say that there's no incentive for variety, because if an insurance company is going to sell a plan to a company that's going to offer it to their employees, that there's no real incentive for there to be a good plan offered. All right, because if they offer a crap plan, then everybody makes crap tons more money. But that's one of the legs, right? That's one of the legs upon which the Affordable Care Act stands. That when we say that you can't, that you're not going to be able to deny people coverage for pre-existing conditions, we're also going to start. They also have put into place minimum levels of coverage that you're going to have to have. You touched on this a little bit later on when you said that people should have lifetime coverage, but that there shouldn't be a law to describe what kind of coverage that should have. And you kind of alluded to something that I wrote down as an a la carte policy. I think that's where you were going.
Something like that.
Yeah, where you can pick and choose the kinds of coverage that you're going to have, a kind of a la carte. I'll take that insurance and that coverage with So
let me describe it for you like this, if I could take just a moment. I'm sorry to interrupt. Let me describe it like this. I envision a health insurance company that says, pay me a premium. Pay me a premium. Your premium. Would you give me just one moment, please?
Sure. And in the meantime, while Scott goes to handle a thing, I will just take this opportunity to tell everyone that for the time being, Dudes Be Debating is going to be
I apologize.
around 9. That's right. I was just saying that for the time being, we're going to think that Dudes Be Debating is going to be live around 9:30 Monday evenings, probably every other Monday or so.
Somewhere in that vicinity. But I'm sorry, again, getting back to my point, I envision a plan whereby a company says, I would like to be your insurance provider. You are currently 44 years old, 100 pounds overweight, and you smoke 3 packs of cigarettes a day. We're going to charge you a premium of X dollars and X cents a month. And for that, we're going to give you catastrophic health care. We're going to cover any illnesses you have. And you are, once you use our service, you are locked in until the amount of money that we've paid back to you has been paid off. Almost like a pre-loan that you pay premiums on, almost like a term life sort of insurance. If you go for 25 years and you have invested or you have reached your term limit of $500,000, you've determined that you wanted $500,000. If you do that between the time you start your policy and X date, then you don't pay anymore. And as a company that I set up, let's say I set up that insurance company, and I don't have to pay anything other than once a month that you go, or once a quarter, you go in for your checkup, and once a year you go in for a mental health evaluation, because I believe mental health should be a part of a healthy plan. You know, you've had an infection here and you've had an infection here, and there's certain coverages that I have, there's certain agreements that I have as far as paying for prescriptions and that sort of thing. But you get to that point, and at that point, hey, you stop paying premiums. Now, if between now and then you go, you know what? I don't know. I want to be a woman. You've determined that you want to be a woman, and it's going to cost us $400,000. I have no idea how much it costs to become a woman. For me, it would probably be around $3 million. I have no idea how much it would cost to make you a woman. But if it's $400,000, then you are locked into this insurance policy and this insurance premium until that $400,000 is paid
off. Look, that's not the way health insurance works.
That's my point.
Well,
why do we have to take something that didn't work and then get the government involved with it, which never works? Name one single solitary government plan that has ever worked.
Medicare works extraordinarily well.
Medicare has a lot of cost overruns and fraud, but other than that, yeah, it works pretty well. But it only works well because it's a very small, I believe it's a very small market.
It is an extraordinarily large market.
Oh, shit.
So Medicare is an extraordinarily large market.
Okay,
Medicaid is an extraordinarily large market. And the Medicare system actually works very well. There's always, of course, going to be frauds. But since the inception of the Affordable Care Act, there have been more cases of fraud brought to light than ever had before. Since the Affordable Care Act, since it went into effect in 2010, and because it's pertinent to the things that I do, I subscribe to things like healthcare IT news and healthcare news and news about healthcare crap. And every week there is another story about another dude or practice. It's never a dude. It's okay. It's almost never a dude. There has been a dude, but it's almost never a dude. It's almost always a practice that has been caught again doing overbilling to Medicare. And when we talk about Medicare fraud, we're talking generally about people. It is generally not that people are billing for services that were not provided. That's generally not the case. Sometimes it is, generally no. Generally what we're talking about are things where there are services, some services are reimbursed at higher levels given higher complexity. Okay. Not every service is reimbursed at a complexity level. Some of them are. Those that are, that complexity is subject to somewhat of an interpretation. Okay. It's not, it is, it's some of it is hard and fast, and you have to check 9 out of 12 boxes. But part of it, a significant part of it, is how much thought did you have to put into this today? Okay. And so that's where a lot of upcoding happens. And that tends to be where you see a lot of that fraud. But besides that, Medicare itself runs fairly smoothly. It has, when it has not run smoothly, it has not been because of government taking it over, but because of the politics involved in government. And what I mean by that is that since 2000, I want to say 6, I want to say it's been 10 years, um, because it's been a long time. There has been uh, a there was a law passed 10 years ago that said that we were going to reduce the amount that Medicare was going to pay. And each and every year since then, Congress said they would put that off another year until Congress didn't, because they weren't doing shit because of partisan politics. Okay. That's what happens in Medicare. It's not the system and it's not the government. It is partisan politics. All right. So
So
you
the
and I are going to.
solution to that was to involve politics in all of it.
No. So the solution to this then is the solution to this is to get is to allow the solution is for partisan politics to work. Okay. Um, there should not be a time when, because of a difference in ideals, that our partisan politics gets to a point where we can't do anything. All right. We can disagree. All right. You and I disagree fundamentally on how healthcare ought to work. That doesn't mean I want to rip your throat out. And it doesn't mean that I don't want you to eat today. Okay. We ought to be able to discuss this in a relatively humane way
Absolutely.
with even flared tempers. That makes things happen. So
I'm too fucking old to get angry anymore. Sorry about the bad language. I'm too damn old to get angry anymore.
I don't think YouTube cares anymore. So
They probably don't, but I still do.
okay. I don't believe in the magic power of words. So I want to jump back to a couple of other things. Preventative care and life coverage with a market a la carte policy. Preventative care is an important part of this not being able to deny people for a pre-existing condition idea. All right.
I believe that should be a law too. It's a simple law. You cannot deny somebody for a pre-existing condition.
Well, okay, but if you're so this so preventative care is already it is a thing that came along with Obamacare, with the Affordable Care Act, to make sure that there is an incentive for people to get healthy and maintain health. All right.
What would that incentive be?
Preventative care.
Okay.
So if you were to have yourself a primary care physician, and
which I do,
you were to go in for a yearly checkup for no other reason than to just say hey to your doctor, and for us to be able to establish an ongoing baseline for your health, right? Because healthy for Scott's biological numbers are going to be different than Andrew's biological numbers. All right. And so we want to be able to compare Scott today to Scott yesterday rather than Scott today to Andrew today. That's a weird comparison. All right.
Yep.
So yeah, that'd be good.
Well, yeah. And of course I have to maintain a checkup every 2 years at minimum for my CDL. So.
Right. So, well, and that's slightly different, but anyway, all of those preventative care kinds of services, and if you happened to be in need of such gynecological exams as pap smears and breast exams, if you happen to be an older dude and need a colonoscopy, this is sign language for colonoscopy here.
I got it.
Then these are all things that are covered at no copay. That means $0 to you. I have type 2 diabetes, and as Walter Grimley would say, I have the diabetes. And so my yearly checks with my doctor, because they are not preventative, anymore. They are with a focus on maintaining my diabetes, right? Then that is not preventative care, right? Does this make sense?
Yeah,
Okay.
I understand.
All right, because there's a thing that it's not like, okay, Andrew, how you doing today? It's more of, and you're maintaining your blood sugar, right? So
What were your numbers?
Exactly.
Yeah.
That's completely different. On the other hand, my medication does come to me without a copay, and my testing supplies come to me without a copay because, as you said, if the insurance company can get away with paying for my test strips, my lancets, and my medication, then chances are I will not end up in the emergency room or in the emergency hospital in a diabetic coma, right? That's less likely to happen, and that would be far more costly. Look, I just think that this idea of using insurance like a savings account or like a loan is just short-sighted. The you know, the healthcare system that we have in the United States is unique in the developed world, in that we don't have a single payer healthcare. And what we have are networks of doctors and networks of pay sources, networks of insurances, and that there are greater benefits for going to the network where an insurance company can negotiate a lower rate than outside the network where the insurance cannot. And you, as a consumer, reap greater benefits going to where the insurance has negotiated these special rates versus where they have not. Um, and perhaps we would be better off if we didn't have these healthcare networks, but we do. And that doesn't mean that they can't be used to the consumer's advantage. But this goes back to people have to know, even if after we sell a person health coverage, uh, we need people to be knowledgeable.
Non-apathetic.
It's not that people don't care. I don't think it's that people don't care.
It's an apathy. They don't think about it. They don't think about it.
No.
Nobody thinks about their health until they're rolling around in bed going, "Why do I hurt so fucking bad?" Nobody thinks about their health until their left arm goes numb. I've experienced that a million times. How could you smoke 3 packs of cigarettes a day, be 100 pounds overweight, and then be shocked when the left side of your face starts to slide off because you're having a stroke? And then not even recognizing that you're having a stroke because you didn't know that your blood pressure was 158 over 102 because you never go to the doctor to check. I've met people who have had excellent health care coverage through their employer. I've gone to their house. They've been very, very sick. They've been very, very sick for a long time, and they didn't know it. And they didn't go to the doctor. And they didn't check on their health. And they didn't maintain their health. And in much the same way, I believe that the biggest problem with healthcare in America is a lack of health education. If we had a system where you had to have health care or had to have health insurance, then we should also instill in that the options for health care as a lesson and teach people about their health care. And where's the best place to do that at? There should be healthcare experts at the hospitals and the doctor's offices, independent of the insurance companies, because the insurance companies are going to try to sell you the thing that's going to make them money. And then they're going to rest on that laurel. But if you've got a healthcare provider that says, look, here's your situation, here's the kind of insurance coverage you need. I'm not going to tell you where you need to go to get it. I'm going to say that there are several different places you can go to get it. Here are some of the most competitive places. That's my opinion.
So what you're describing are things that happened only after the Affordable Care Act was passed, right? I mean, All the things that you just described only happened because the Affordable Care Act was passed. We did not have then marketplaces for uninsured people to go to in order to make these kinds of choices. And one of the things that came out of the Affordable Care Act were people called navigators, because there was going to be the need for people to be able to navigate to the plan that's going to meet their budget and their needs. There are state certified navigators, and there are federally certified navigators. Um, I'm not going to speak to the navigator certification process because I have not gone through it, but none of those people are compensated for being a navigator. Okay. None of those people, in fact, if you go to a navigator and the navigator asks you for money, you have not found a navigator. You have found someone who's claiming to be a navigator and is not actually a navigator. No. Because that's the law. In fact, these are people who are supposed to be able to help you get to the marketplace, find the policy that's going to meet your needs and your budget, and talk to you about these tax subsidies that, again, people who make less than 400% of the federal poverty level qualify for some tax subsidy on their health insurance premiums.
May I interrupt you just there for a moment? May I interrupt you just there for a moment? Prior to the Affordable Care Act, I was working actually at the Clay County Sheriff's Department. There's a little name dropping, and I'm not going to get into all the details of it, but in order to cover my wife and my family with the insurance that was offered to me through the Clay County Sheriff's Department, the cost was very prohibitive. I'm just going to say that for me. There may be several people out there who enjoy it. To cover myself through the Clay County Sheriff's Department was absolutely free. But to additionally cover my wife and my children was cost prohibitive. So we canceled the insurance, and we went online and said, I need health insurance. And there were several different insurance agents that came up, and I called several of them, and I got estimates from them, and some of them came out to my house and introduced themselves to me, and I ended up choosing a plan with Anthem Blue Cross Blue Shield, and they sent a gentleman out here who did a swab in our mouth and checked to see if we were smokers, because at that time both my wife and I were non-smokers. I am hence a reformed smoker / non-smoker. I went back to smoking, and now I am a non-smoker again. My wife, who has to live with me, kept smoking. But I had insurance coverage and I had dental coverage that I acquired privately. So I don't know why you say there was no market for it. I had an Anthem Blue Cross Blue Shield card that I took to my doctor when I went to my doctor. They said, you're covered. And I said, this is my insurance card. And they accepted it. I had to pay a copay when I went to the doctor, like if I had an infection or I had bronchitis or I took the kids in there. I paid the premium and I paid the doctor the copay. And that was good enough for a long time. So maybe I found the mysterious dark web insurance. I'm not sure, but that's how I got my insurance coverage. It was not through an employer. It was not through my wife's work. In point of fact, she was not working at that point in time. She was preparing to go to the Middle East. So I don't know. I mean, that's my personal experience. Maybe I was one out of the entire population of the United States, but I don't think so.
So there's always been the option to go and shop for yourself an insurance policy. That's always been the case. You could always go to Anthem and ask them for a policy. The difference is that we've had a lot of practice shopping for insurance when it comes to our cars, right?
Sure.
We've all of us have had plenty of practice shopping for car insurance, or we should have. All right, we understand copays and deductibles and comprehensive versus whatever. Okay, for our cars. All right, but we haven't had, many of us have not had that kind of experience with health insurance. We don't know how to shop for health insurance. And if you've got a whole bunch of insurance companies buying for your dollar, then that's cool. But most people, when faced with shopping for car insurance the first time, have the wisdom and experience of someone next to them who has shopped for car insurance before and understands what a premium is, understands what a copay is, understands what a deductible is, and what these things are going to cover when they buy car insurance. Collectively, as a nation, we don't have that kind of experience for health insurance. It's not a big leap, all right, from one to the other. All right, we're still using the same kind of language here. It's still insurance, but we just don't have that kind of experience. That's the role then that the navigators are going to fill, and they're going to fill it using the products that came to the marketplace, because these are Anthem doesn't just sell a Anthem policy, right? They don't have,
I'm very aware of that.
right. There is not just one policy that they sell. No, they sell lots of policies at lots of different numbers with lots of different benefits and twists and turns and this exclusion and that lots of different ones. Okay, if you can think of a kind of healthcare policy, Anthem will sell it to you. So
you can probably make your own up and talk them into covering you.
Right. So, so this brings back. So this is part of what the Affordable Care Act did. It said, listen, not only are you going to have to cover people with pre-existing conditions, not only are you going to have to cover their preventative care with no copay, you are going, but then these are some minimum coverage levels that you're going to have to provide to people. In other words, you're not going to be able to take that people's money and deliver nothing in return. That was part of the reform that was going to be passed. You may remember that the law says that insurance companies must spend at a minimum of 80% of their premiums on health care payments. All right, that they must take the 80% of what they receive in premiums and pay that out in coverage for a thing. All right. So if they're not, and if that's not happening, then either the premiums need to go down or the payments need to go up, one of the two.
Okay.
That was part of the Affordable Care Act. What we did then is we brought actually the companies that we brought here in Indiana were MDWise, Anthem, and there was a new one in 2016. It is, in fact, Managed Health Services commercial product. All health.
I don't know. Let me look at my card because that's what I got.
Oh, is that what you got?
I think so.
Okay.
Let's see if I got my medical. Amanda might have my medical card because I'm stupid. But I can admit that, so it's okay.
Then it's in good hands.
I'm not going to fault the desire to do something. Here is my fault with what they have done. And we are running short on time, so I'll make this my summary and you can rebuttal. My problem is you took something that's incredibly complex, the health insurance / healthcare system. You embedded it in a government which is rife with crony capitalism. And even though the intentions were all good at the time that it was done, I patently assure you that within 20 years, all of the good intentions will be gone. The companies who need to profit the most will have the politicians in their pocket to turn this thing around for the home team, bring it in for the big win. And that's going to be good for everybody, and a politician's going to sell it to you. So they have taken it out of my personal hands to ensure the safety of myself, the health of myself, and the health of my family in an interaction between me and the person who is providing me the product, which is healthcare, and how I determine how I want to pay for that healthcare. They didn't offer me new options. They didn't offer me new ways to do that. They said, the old way is good enough. We're going to tweak it a little bit, and you're not going to have to worry about it. And I worry about it. I will worry about it. I'll watch politicians. I have the congressional votes bar up on my search screen, because when they have a vote, I go and I look at what the bill was. I read the bill. I read the summary of the bill. I read the way every congressman, every senator voted for state election or for state legislation and federal registration, because I don't trust them. But you're taking more of my choices out of my hands and putting it into theirs and spreading it out throughout the population of the United States. And I'm not going to say a large portion of the population, but I will say that there is a portion of the population that is greater than one, that is completely apathetic. And if they hear the right words, they're not going to pay any attention to anything else. So that is my problem with the healthcare law in general. It was incredibly complex. It was spread across many, many, many things. And nobody, save a couple of people, I tried to read the entirety of it and understand it. But just like business terms and investment terms, they make that thing some sort of magical language that very few people can understand. And they make it incredibly dry and incredibly boring, so that within 3 minutes of beginning reading it, you pass out and fall asleep. And that's how they keep you from understanding what's going on. And I don't like the fact that we're going to add additional layers of insulation so that the next bailout is going to be the insurance company when they start doing bad things.
So, look, I'm not exactly sure where you're seeing this shrinkage of choice. It sounds to me like you got an insurance policy from the marketplace. That's an exercise of a choice that was afforded to you through the Affordable Care Act. I don't understand where you see the monopolizing of where you can go to execute your health coverage and your health care. In fact, I see in practice the opposite, that you have more options today than you did prior to the Affordable Care Act. In fact, you have so many more options that you still have the options that you had to go to the private companies yourself. But now the companies are going to come to you with other options that they think, perhaps incorrectly, that are going to be best suited for the uninsured's needs. Um, it is true that the healthcare industry has issues, and it is exceptionally true that the Affordable Care Act did not address all of them, but it wasn't supposed to. Again, the Affordable Care Act was really only going to address one problem, and that was so many uninsured folks. We haven't addressed access. We haven't addressed the care itself. We haven't really addressed, we are now starting to address something called value-based outcomes, which is a mess. Uh, we have a big debate on how to deliver that care, but none of that was part of the Affordable Care Act. The Affordable Care Act was only designed to begin to address the problem of the uninsured. It is extraordinarily true that that the bill itself is huge, all right, because it had to do so much. You know, we've barely scratched the surface on what the Affordable Care Act did, and we really didn't talk about how it didn't even get to Indiana until just last year. And in no way does the way that it came to Indiana resemble the way it got to any other state that expanded Medicaid. Okay, any other state that expanded Medicaid except Indiana just expanded Medicaid. But here we have a convoluted system, not because of Obamacare, but because we have Pence Care here in Indiana. And again, that goes back to my biggest complaint with the law, is that it did not go far enough. And it allowed for governors like my governor, like your governor, to wheel and deal with the federal government to say, well, I'm not going to do everything, but can I still get the money? And the federal government said, dumbly, yes. All right. So, okay. So I'm not going to put all the blame on Pence. He wrote it. All right. But the Obama administration accepted the deal because they're idiots. All right. They should have just said no, but they didn't. So we got it. All right. And now other states are going to follow suit because they think that Pence is smart. That's just dumb.
We'll have to discuss later, at a later point in time, why you just lauded the virtues of the healthcare that I could get here in Indiana and then said it was stupid.
The healthcare you got came through the marketplace, which is not administered by Pence. Pence has decided not to set up a marketplace in Indiana. That's why Indiana's marketplace is run by the federal government. And you may remember that, I don't know if you're getting a tax subsidy on your premium or not, but you may remember a Supreme Court decision a few years ago that was going to take those subsidies away from you, okay, because of the language in the bill that said that state-run marketplaces were going to allow for these subsidies, and well, we don't think that applies to states that decided not to run their own doggone marketplaces. And fortunately, thank goodness, that was struck down in the silliness that it was. But again, my complaint with the Affordable Care Act is not that it did too much. It's not that it took. We certainly could use a single-payer healthcare system here in the United States. We could certainly use more access to care in the United States, but none of that is what the Affordable Care Act was designed to do. It was only designed to address the uninsured. And to that end, to the end of addressing the uninsured, I think it has been an incredible success and continues to be, even in Indiana, where we have not fully enacted one of the three pillars upon which that law was supposed to stand.
Fair enough. I'll leave it at that. Again, my experience from the healthcare field, as it were, is that a vast majority of the problem with our healthcare system and our healthcare insurance is apathy on the part of people because they are not accurately planning and preparing for the future. But that's also an economic discussion. That's also a savings discussion. It's a million and one discussions about how the problems that plague our country and the world really stem from a lack of foresight.
So next time we are going to schedule this for 2 weeks from tonight, and we are going to talk about economics.
We could do economics next time. That leads directly a part of what we're saying. And I believe between now and then we'll have a better handle on who the candidates are going to be. I have to ask you, because I don't believe I've ever asked you,
Sure.
which candidate of the incredibly diverse choices of candidates we have do you believe you're going to support? I'm curious. You can take us off live if you want to.
Oh no, I can go live and say that I'm going to support Sanders in the primary and end up voting for Clinton in the election.
I'm going to. I supported Trump in the primaries. I've made no secret about that. I don't think I'll have to vote for anybody but Trump in the election. Although I will freely admit that the Republican Party is really damaging its own credibility right now.
Yeah, well, and we should have a talk about the candidates,
Sure.
perhaps after the candidates themselves have solidified. So after at least
After the
after
primaries,
May, yeah, at least after our primary here in Indiana,
which is going to be
we should
interesting
come back
because
to
it's
that.
going to be the first primary I've ever voted in.
What?
Yep.
You voted in lots of primaries.
Never voted in a primary. I've actually my entire life been registered independent, and I mistakenly believed that as an independent I was not welcome at the primaries. So that shows you how much I've learned in just the last 8 years.
Okay, yeah, we're gonna have to talk about that too.
Oh, absolutely.
So do you want to end this by putting out any of your contact information, how people can get in touch with you and say, Scott, you totally wiped the floor with that dumb Andrew dude. Thank you for saying what I needed to say.
It'll probably be more like the responses I get on Facebook, and I can't repeat a lot of those here. Yeah, if you'd like to, you can contact me at Scott, SCOTT, at SaoliLLC.com. That's the name of my company. It's S as in Sam, A as in Apple, O as in Onion, L as in Lima, I as in Indigo, L as in Lima, L as in Lima, C as in Charlie.com. And just to make it a little easier to remember, the name Saoli is derived from the first letter of the first name of everyone in my family. Scott, Amanda, Olivia, Logan, and Isaac. Exactly. Scott, Amanda, Olivia, Logan, and Isaac. And it's in order. Oldest
I got that.
to youngest.
Yeah, I got that after you said it, but then I realized that nobody else is going to get that.
Well, yeah, I didn't know if I wanted to put my kids' names out there, but it's okay because I believe in the Second Amendment, so don't try anything.
So I've put my kid on YouTube before too. So
yeah.
So if you want to find me to tell me how I wiped the floor with Scott tonight, you can get a hold of me at andrewtheatheist@gmail.com. You can also find me on the Atheist Roundtable podcast. I usually put that on Sunday, but I haven't been doing that for a while because, well, my wife's health situation. So that's just kind of the way that's going to be for the time being. So until next time, we will stop broadcasting now. Bye-bye.
Thank you. Bye.